There are 3 OTs.
Okay.
And all the OTs can be done here, like lap chole, appendix, LSC. I take anesthesia if I will not wake up. Most common fear is death only. But here I want to say the audience that no need to fear, because we anesthesiologists are here so to make you sleep and then wake you up also. It's our duty, and more than the patient, it's actually our responsibility.
A warm welcome to the listeners of USTM podcast. I am your host, Dr. Madhushmita Borthakur. And today we are going to discuss a crucial topic on common anesthesiology, its health issues, its concern, and any risk assessment related to it. Yes, of course, for many, the thought of undergoing anesthesiology is quite concerning. But of course, with proper medical equipments and a proper hospital, there is nothing to worry about. So, today we have with us Dr. Gyanashri Khaun, who is an assistant professor, PA Sangma International Medical College and Hospital. We are delighted to have ma'am on board today. Ma'am, welcome you once again to our show.
Thank you so much.
Ma'am, before the start of this show, can you please enlighten our listeners about your background, like what has led to choose this anesthesiology as your career?
First of all, thank you so much for inviting me here. I am Dr. Gyanashri Khaun, Assistant Professor in the Department of Anesthesiology, PIMCH. I have done my MBBS from Assam Medical College, and after that I did my MD from Guwahati Medical College. And since then I am doing private practice only, and recently I have joined here as an AP in the Department of Anesthesia.
That's really nice to hear it from you, ma'am. Coming to the general topic, like people are always concerned about the risk factors associated with anesthesia. Could you please elaborate any frequent risk associated with the intake of anesthesia?
Okay, so risk factors there are associated. Actually, we have 3 types of anesthesia: general, spinal, and sometimes we give block. So complications are also different wise, category wise. Like in case of general anesthesia, after giving, many patients, not all patients, few of the patients may complain of vomiting, nausea, then post-operative sore throat can be there. So these are the common complications. Then in case of spinal, it is a very common complication is PDPH, which we say that is post-dural puncture headache, or in normal layman language we can say just headache. Like all the women who are taking doing CS and they are taking spinal anesthesia, if you ask a lot of patients, you can hear that they will have a headache, because we always say after giving spinal anesthesia, just don't move your head from the pillow and everything, you just have to lie straight. But people don't understand and they move, that's why they are having the headache. And treatment is that you have to take a lot of fluid. That's why after CS and all also we tell the patients take a lot of fluid. Intake of fluid should be maximum 2 to 3 liters you should drink at least, not to have that headache. So that is related with spinal. And then in case of block, there is something called local anesthetic systemic toxicity. So layman term, it is difficult really to explain, but like patient may have seizures and all, and we have treatment for it. It can be treated, everything can be treated, it's not like that. And these complications are also sometimes only it happens, not always. Otherwise, there is no as such risk.
That's really reassuring, ma'am. Ma'am, let us talk more about PA Sangma International Medical College and the hospital, how it ensures patient safety. Can you please tell us about the hospital and the operational facilities?
Okay, actually, here we have a very well equipped OT.
Okay.
There are 3 OTs,
Okay.
and all the OTs can be done here, like lap chole, appendix, LSCS. All the OTs has been done, and the post-operative care is also taken off very nicely. There are many technicians and sisters available which look after the patient, about their recovery. Post-op recovery unit is also good, and in OT we have all kind of machine, all kind of drugs available. So here all the OTs are being done as we told, and we doctors here ensure the safety of the patients.
That's really a great information, ma'am. Technologists and research are still advancing. Still, our people are having some fear of taking anesthesia. Ma'am, could you please tell our listeners why anything about related to it? Why our people are having such a fear of taking anesthesia?
Okay, so first of all, this question is very common. Obviously, for a common people, he will have a fear that if I take anesthesia, if I will not wake up, most common fear is that only. But here I want to say the audience that no need to fear, because we anesthesiologists are here so to make you sleep and then wake you up also. It's our duty, and more than the patient, it's actually our responsibility. I, as a doctor, as an anesthesiologist, I feel that the fear should be mine. It should be more than you, because you are dependent on me. Your health is dependent on me. To wake you up, it is my responsibility. So no need to fear, people. You can have a very safe anesthesia, and it's not a problem.
To our listeners, patients should not be worried about taking anesthesia. Of course, patient safety is of top priority. To wind up, I thank you, Dr. Gyanashri, for sharing your valuable insight into this crucial topic.
Thank you so much.
I hope this discussion has helped the common people to understand the topic of anesthesia. And it has also highlighted the world-class facilities that is available in the PA Sangma International Medical College and the hospital. To our listeners, if you have any questions, feel free to drop them in our comment box. Do not forget to like, share and follow for such insightful discussions. Until then, I, Madhushmita Borthakur, signing off. Stay healthy, stay informed. Thank you.